The Alliance for Aging Research is a national nonprofit organization located in Washington, D.C. And our mission is to promote medical research as a way to improve the experience of aging and health. The Alliance for Aging Research's main priority is always to identify gaps in research and care for older adults and their family caregivers, and then to fill those gaps with policy changes and health education programs. In the area of policy, of public policy in particular, we're going to be working on healthcare reform to make sure seniors and their loved ones have the coverage that they need. We're going to be working to protect Medicare and Medicaid, and to raise funding at the National Institutes of Health. In health education, we're going to continue our efforts in geriatric cardiology issues like atrial fibrillation and heart valve disease, and we're going to be giving the public the facts about vaccines and making sure that they have access to the vaccines that they need. Well, the heart has 4 valves. And heart valve disease is when you have damage to one or more of those 4 valves. The heart's valves are responsible for pumping blood in and out of the heart. And when that's not working properly, you can develop heart valve disease that sometimes can not be that serious, but other times can be very serious and result in complications, even including death. Some people don't have any symptoms with heart valve disease, which is one of the reasons why we encourage folks to get their heart checked regularly by their doctors. But folks who do have symptoms of heart valve disease might experience shortness of breath, fatigue, dizziness, even fainting, and generally just feel sort of out of sorts. Sometimes heart valve disease can be picked up by a doctor listening to your heart with a stethoscope and hearing a murmur. Heart valve disease affects up to 5 million people in the United States, and 22,000 people die of heart valve disease every year. Heart valve disease affects folks at very early ages. Some people are born with heart valve disease, and that's called congenital heart valve disease. And it also tends to affect the very old. So people age 75 and older, as many as 1 in 8 have moderate to severe heart valve disease. Also, people who have had a previous heart condition are at high risk of developing heart valve disease, and people who have high risk for cardiovascular disease in general. So if you have high blood pressure or diabetes, you're also at a higher risk of heart valve disease. National Heart Valve Disease Awareness Day occurs on February 22nd every year, and February is also known as American Heart Month. And it's a day really that's designed to raise awareness of the symptoms and risk factors of heart valve disease so people can learn and go to their doctor if they think they might be at risk, ask questions about it, and ultimately it's to make sure that people get diagnosed and get the treatment they need and to save lives. We established National Heart Valve Disease Awareness Day because we recognized through some survey research that we did last year that despite the fact that 5 million Americans have heart valve disease, public awareness of heart valve disease is shockingly low. In fact, our survey research found that 3 out of every 4 Americans know little to nothing about heart valve disease. So we established the day to really change those numbers, to raise awareness of the risks and the symptoms, and to make sure people get the treatment that they need as quickly as possible. We have 4 calls to action for National Heart Valve Disease Awareness Day. Listen to your body, know your risk factors, get your heart checked regularly, and spread the word and raise awareness. We're going to be doing a couple of activities because this is the first ever observance of National Heart Valve Disease Awareness Day, this February 22nd. So we're going to be doing a briefing on Capitol Hill, and it's going to be in the Capitol. And we have some amazing featured speakers. We have the director of the National Heart, Lung, and Blood Institute, Dr. Gary Gibbons. We have the immediate past president of the Society for Thoracic Surgeons, Dr. Joseph Bavaria. And we have two American Heart Association heart valve ambassadors, Dennis and Ann Dubkowski, and they're going to be sharing their personal story. So it's going to be both informative as well as inspirational. And that's going to be from 12 to 1 Eastern Time. And if you want to tune into the live stream, you can find out how to do that at valvediseaseday.org. Then at 4 p.m. Eastern Time, we're going to be doing a Twitter chat, which you can follow at the hashtag Valve Disease Day. And you can also find out more info on that at valvediseaseday.org. And that's going to feature experts, and we're going to answer questions, and we invite everybody to participate in that with us. For National Heart Valve Disease Awareness Day, we've partnered with 20+ organizations, from the American Heart Association to the American College of Cardiology to Women Heart and many others. And we feel very lucky to be partnering with them. Many of them are doing their own observances throughout the country. So there's going to be a lot of excitement and a lot of things going on. National Heart Valve Disease Awareness Day takes place every year, so please mark your calendars for February 22nd, and remember to always listen to your heart. And to find out more information, please visit us at valvediseaseday.org.